Hi, everyone. Doc T here again with another episode of the Horse Advocate Podcast. Thank you so much for joining me. This is going to be my final one on the Florida Association Equine Practitioners meeting. And this one for me was why I attended. It was all about metabolic syndrome in horses, specifically PPID and ID and 10-4, good buddy. I also had two other things. One other thing I want to discuss, which is vitamin E. And I think these are all important topics for everyone to know about. But before I get started, there's two things I wanted to say. One, I had a great conversation with a gal who I've known for a long time, a veterinarian, a great ultrasonographer, and we only see each other at these meetings. She has a history of going to Cornell as an undergrad, and then she took some time off, then she became a veterinarian. And we were talking about the crisis in equine vets, and she was as well as she gave out a dire warning. She says, we really don't know where this is going to end up. It's just so difficult to find somebody to come in and buy the practice. As we get older and start selling these practices, the new guys don't want to come in, not for the money that we're earning. They want more income. They believe they deserve more income. They're getting at the small animal side. To which I said, well, it's obvious. I mean, you can get a cat and a dog for free at the pound, basically for free, a donation, whatever. And now you've got this animal, and it doesn't take a lot of money to actually feed it relative to a horse. You don't need to buy a farm and have land and have the maintenance and upkeep of fences and barns, or you don't have to have a boarding stable where you pay a lot of money to have somebody else do it. You just basically put the dog or cat in your house. And if there's a medical emergency and they say it's going to cost you $3,000 or $4,000 or $5,000, you get a credit card out and you do it. But as horse people, we've invested so much money already and the time into keeping our horses that it's draining us of thousands of dollars a month. And the Horse just had a magazine, the Horse magazine just had an article about what's the true cost of keeping a horse. And it's quite a wide range, but it's well over $1,000, more like $1,700 a month. And there's other factors that they didn't include in there that you have to. So yeah, it's very expensive to keep a horse, and then add on top of it what we should be charging for our work. And it's going to be out of the range of most people. She gave me an example of what a regular blood work cost. And they said in the small animal clinic, they're charging $350 for blood work. And it's way more than we do in horses. So it all boils back to, if you're going to own a horse, then you need to get the horse's house in order. And you're going to hear me say this over and over again. You have to learn how to prevent these diseases. And that just triggered me in a whole different thought process as I listened to a very intelligent gal, Dr. Dianne McFarlane, who is a professor at the University of Florida with a lot of experience both in the field and as a researcher and now a professor, all about endocrine diseases in horses. And I kept coming up with the same question, which I'll get to at the very end. And no, I didn't ask her. And the reason I didn't ask her is because it was going to put her in a corner. And I didn't want to put her in a corner. And the corner, she'd either say, well, we've just never studied that, or that's not relevant, or she'd have to make up something, but it'd be an empty deal. And that's the problem. It's just an empty deal because there is no research. In fact, some of the research that they were doing, that they go through here, is on a group of 6 animals, or another one on 30 animals. That number just isn't big enough, folks. I mean, to get a really statistically significant response to any work takes thousands of horses just to get the individual variation in different spots all over the world to try to get a better idea about this. So maybe what I need to do is tell you my end thought as I go into this. And the end thought was researchers are trying to figure out the pathology, which means the process that occurs when a disease happens. But they're not doing what's needed to get at the root problem. So, in other words, they would inject a horse with insulin and cause these horses to become foundered just by injecting a dose of insulin. And that's okay, but that's not telling us what's really going on. They're trying to dig down deep and figure out whether it's the insulin-like growth factor receptor and its response to insulin. And they're not looking at why does black walnut shavings cause laminitis? Why does supporting limb lameness cause laminitis? I mean, there's no insulin involved in either one of these things. And yet they still get insulin, laminitis just as badly as this endocrinopathic, endocrine-based laminitis. So there's just some questions. And the other was PPID, the pituitary pars intermedia dysfunction, which she says is a dopaminergic neurodegenerative disease, which is exactly what I've been saying like forever. I've been saying it's a neurodegenerative disease. The hypothalamus and the pituitary are not communicating anymore, and dopamine's the problem, which is a neurotransmitter. But no one's saying, well, why is it a problem? You know, how can we cause PPID in normal horses? What treatment do we give that will cause that? I mean, it sounds really bad, but do bullets cause death? No, but firing it from a gun does. If I throw it at you, it's not going to do it. So they're finding all these shell casings, and they haven't found the gun yet. They don't know what's starting this whole thing. So anyway, that's just my bias, and I'm going to be quiet for a minute and just tell you about what this professor gave to us. And again, the first things out of her mouth was PPID is what PPID, by the way, is what everyone calls Cushing's disease, and that's okay. And they call it a dysfunction of the pars intermedia part of the pituitary, which is a very specific part of the pituitary gland, which is at the base of the brain. It's a very small gland. It's about the size of a pea normally, and it enlarges when this disease occurs. And I've been saying it's not a dysfunction. The pituitary is working perfectly. But I have to retract what I've been saying there and amend that. What's happening is, for whatever reason, the pars distalis, which is the part that's distant, distalis, is the primary source of a precursor or prohormone or messenger hormone called adrenocorticotropic hormone, or ACTH. And ACTH is what your vet is measuring when they take a blood sample. And the ACTH is coming from the pars distalis. But when this horse has the disease of PPID, it is now coming in like 3 times the amount from the pars intermedia, which is not supposed to be producing this. So I have to give it that it is a dysfunction of the pituitary. There's no doubt about it. I get it now. Pardon me for saying that it was the pituitary is acting according to what instructions it's being given. But that part is actually true. It's just that it's the pars distalis, and that's doing just fine. So before you close your eyes, tune me off, just hang in there. I'm going to explain all this stuff because she did a really good job, and I have some really good notes. This is a take-home message, which I'm putting at the very beginning because she repeated this a dozen times. Your horse must have clinical signs of the disease before you can put any value on a diagnostic test. And I know so many people who have drawn blood for ACTH and come back with a diagnosis of Cushing's in their horse, or PPID, when the horse is showing no signs of it. And the horse is now on Pergolide or Prosend, the product that's made that is Pergolide, Prosend, when they don't have to be on it because they don't have PPID because there's no clinical signs. they said you have to have clinical signs. Now, here's the other thing. People say, yeah, I drew blood because I thought it was Cushing's. Look how fat he is. Look at all these fat pads and the crusty neck. Well, it turns out that PPID is a catabolic, meaning a breakdown of tissue. So horses do not get fatter. If your horse is getting fatter, he does not have PPID, or if he does, he also has insulin dysregulation, or what I call insulin resistance. And that's worse. So you need to be treating insulin resistance, or what they call ID, insulin dysregulation. And once you start to get the horse to lose some body fat, then you might see that the hair coat isn't shedding and other signs of PPID, and then you can start treating, and then you can look at your ACTH levels. So I thought that was really, really interesting. Also, PPID is kind of analgesic because it's releasing more opioids in the system. So they may get laminitis, but it just doesn't seem as painful as a regular laminitis horse. And laminitis is so painful. So the enlargement of the pituitary is coming from the pars intermedia. And again, just think of the pituitary as the size of a pea, split into 3 spots. One's the distalis, one's the intermedia, and the other one I forgot already, but it's not proximal. Anyway, so there's 3 parts, and the intermedia is what's becoming dysfunctional and enlarges. You're also going to have weight loss. You're going to have muscle atrophy. You're going to have opportunistic diseases such as pneumonia, upper respiratory diseases, abscesses. Some of those abscesses can occur in really bad spots like the brain and cause the death of your horse. It can cause behavioral changes and increased laminitis. She also said anhidrosis and the polyuria, polydipsia, which means they pee a lot and they drink a lot, and you can get more soft tissue and bone injuries. Now, and then she specifically said, if your horse has suspensory disease, it's not PPID. I kind of laughed. Of course, it's not PPID. But if you look back at this weight loss and muscle atrophy and opportunistic diseases, and behavioral changes, and increased laminitis and anhidrosis, all of those things, again, are from feeding inflammatory foods and not feeding enough protein, because your immune system isn't right. The blood-brain barrier is being inflamed, so you have behavioral changes. You're going to have more diseases, and the muscle atrophy is just from absorption of protein. So I'm going to hint a couple of times. Gee, doc, do you think it could be because of the way the horse is fed? I mean, she kept saying that PPID is only in older horses. And I know some people say, well, I've seen as young as 8 years old. But she's saying, no, it probably isn't PPID, it's something else. You should be looking at older horses, 15-year-old on up. And they're losing weight, and it's getting worse with time. And I'm like, older horses are chronically protein deficient. They're going to be losing their top line. Their hair coat's going to look like crap, and it's going to get worse over time. So I have at least 2 diseases I just laid out, PPID and chronic protein deficiency, showing the same thing, which brings me back to my beginning debate with her. What causes this PPID? What causes this neurogenic problem in the horse? And I know she's going to say, well, it's age-related. And, death is age-related, although I know a lot of people are young who have died. So death can't be age-related. It's because they jumped in front of a bus, right? So just because a horse is getting older and is showing signs that have other diseases, could it be something else? And I know so many of you who've listened to this have tried taking your horses off inflammatory foods, and your non-sweating horse has suddenly started to sweat within 3 or 4 days. Sometimes it takes longer, but they get better. And then you start adding high-quality protein, their hair coat looks good, and then you measure their ACTH, and it's now normal. So, it's anecdotal. I haven't done a trial of 1,000 horses that all looked the same and had high ACTH, and then we took off the grain and started adding soybean meal. I haven't done that. Why? Because I'm not into that. I think, you guys who have the millions and millions and millions of dollars who want to do this need to contact Dianne McFarlane at University of Florida and say, look, we'll pay for this kind of study. Let's do it. Anyway, so to diagnose PPID, the first thing she says is make sure they have all the signs. They're older horse, they're losing weight, and it's progressively getting worse. Again, that could be anything. So then you take a basal plasma ACTH. In other words, your vet draws the blood and sends it off. What's interesting is they have to draw it in the right tube. It has to be kept upright. It has to be put in the cooler. And you have up to 12 hours. It's more than 12 hours. That sample is bad. It's just not going to give you the right results. It has to be shipped, cooled, or frozen overnight, and it has to go to a specific lab, and you have to use those labs' references because they change depending on what lab you want to do. So there's a high false positive rate to testing, especially if you don't have clinical signs. So again, if your horse doesn't have the clinical signs, he's obese, he's not losing weight, and it's not progressing, then what's the point of doing a test? Anyway, then there's some dynamic testing to do, and there's seasonal testing. And the seasonal is interesting because the ACTH rises in the fall between August and November in the Northern Hemisphere, at least in America. I don't know what it does in your neck of the woods. You'll have to ask your veterinarian there. But if you draw blood in, let's say, October, and it's a high ACTH, it could be absolutely normal for that horse because especially if there's no signs. There's no signs of the disease. The blood value is probably false positive, and you should recheck it again in the spring. And if it drops down to normal, then your horse doesn't have PPID. But if it's a normal ACTH in the fall, then it's not PPID, even if he has signs. So if he has muscle wasting, a poor hair coat, and it's getting worse, but in the fall you draw blood for ACTH and it's normal, it can't be PPID. Does that make sense? So you can have a high ACTH in the fall with no signs and it's not PPID. But if you have signs and a normal ACTH in the fall, it's not PPID. I think that's pretty important. So let's see. Use fall testing to rule out PPID. So if you think your horse has it, test in the fall. If it comes back normal, your horse doesn't have PPID. If it comes back that it's elevated and they have the clinical signs of weight loss and it's progressing, then probably has PPID. But then again, we really don't know what's causes neurodegeneration. So, all your vet's going to do is put on percent, and maybe your horse is going to go off feed, who knows? But the point is, you've got a diagnosis and everybody's happy. Back to the ranch. Maybe not this ranch, but anyway. Then there's this TRH, thyroid releasing hormone stimulation test, where you give the vet gives a shot, and then 10 minutes later, they do a blood sample. Now, it's really important, she says, you can't do it at 9 minutes and you can't do it at 11 minutes. You have to set a timer from the point you inject, and at 10 minutes, you draw your blood sample, and then it's good. They said, do not do this in the fall season because it's going to come back high ACTH. All right. So the other thing is it doesn't confirm neurodegeneration because it's going to get a high ACTH from something else. Here's her some of the takeaway things. She says it's hard to detect PPID early due to lack of clinical signs early on. The disease is going to be well underway before you start to see clinical signs. And also, clinical signs are shared with aging, poor management, equine metabolic syndrome, lack of protein. Anyway, so there's too much confusion with testing. So she recommends that the best thing to do is to monitor your horse over time. Take serial samples, like take one in the fall, take one in the spring, and see if the ACTH is within normal ranges. So if it's low in the fall, your horse doesn't have PPID for sure. If your horses are fat, you're going to normally have high ACTH in the fall. That's just the way fat horses are. But they could also have equine metabolic syndrome as well. And she also noticed that gray horses, for whatever reason, also have a high ACTH in fall. So be aware of that. She said 1/3 of horses with PPID also have insulin dysregulation. That's really important to know because the increased risk and severity of laminitis is staggering if your horse has both insulin dysregulation and PPID. So if your horse just has PPID without any insulin dysregulation, then your horse won't get laminitis. That kind of goes along with my expression, I've never seen a skinny horse get laminitis. And what I'm saying by that is, as long as insulin is working properly and it's not being fed a lot of sugar, skinny horse isn't going to get laminitis. But I know personally skinny horses that they weren't obese at all and they had horrible laminitis. So there's something to that part too. All right, so then she moved to the next lecture, which is called Prevention of Endocrinopathic Laminitis by IDing ID. So in other words, we have to look at insulin dysregulation. And she said basically insulin dysregulation is a problem in horses fed excess intake of calories. It's also a lack of exercise. It could be associated with deworming, take away some of that resistance. She said 40% of ponies have laminitis. There's 3 other types of laminitis. She called it sepsis related. So if your horse goes into toxic shock from colic, they can get laminitis. Supporting limb lameness. So if the horse breaks a leg and you cast it and they're putting all the weight on the other forelimb, they can get laminitis. She did not mention eating black walnut shavings, which surprised me, but I guess that might fall under the sepsis related. And then, of course, the endocrine related, which is 90% of all laminitis. And endocrine basically means that insulin is being dysregulated. And of course, you have pasture associated, which is, as far as I'm concerned, a more sugar load than the horse needs. And then, of course, you have the fancy word iatrogenic, which means your vet gave your horse a bolus shot of dexamethasone, and next thing you know, your horse is laminitic. So we have to be careful. She said the disease basically is triggered by insulin. The endocrine cause of laminitis is triggered by insulin. So they gave IV insulin to healthy horses, and they got laminitis, just like that. And they look for insulin receptors or the GLUT4 transport receptors in the lamella, the secondary lamella, which are the leaves inside the hoof that bind the hoof, attach the hoof to the underlying bone, the coffin bone. And that's where the lamina become inflamed and pull apart, and that's where laminitis occurs. And the GLUT4 process, the GLUT4 transport, you might have remembered, is the butler that you send to the door, you in your little house called a muscle cell. And when insulin knocks at the door, GLUT4, the butler, goes to the surface of the cell and opens the door, and insulin tosses in the glucose and then turns away and runs back to get another molecule of glucose. And GLUT4 closes the door. This way, the outside of the world doesn't come inside the muscle cell. And it's called the GLUT4 transport. Well, there's GLUT4 receptors. They were looking for them. They did not find any insulin receptors or GLUT4 receptors in the lamina of the hoof. So then they talk about insulin growth factor 1, IGF-1, which is interesting. It is an enzyme that basically causes the growth of tissue when there's insulin around. Insulin is basically signaling, hey, we've got extra energy here. Go ahead and start growing things. And they were looking for that in the secondary lamella, which are, again, the sensitive part of the lamina that hold the hoof and the bone together. And they looked at it several different ways, and they could not come up with a reason why giving insulin causes laminitis. It's not a clear path, but high insulin is needed. And I thought that was interesting. So they're trying to cause laminitis by injecting insulin. But we know that insulin is high basically because you're feeding excess sugar, which is causing the pancreas to release more insulin. And as insulin is resisted, it's running around trying to scavenge up all the excess glucose in the blood to make sure it doesn't damage the blood vessel walls. And they're suggesting that that's going into the lamina and causing this laminitis. I think that it's possible. I mean, these people are a lot smarter than me. I mean, so much smarter than me. I mean, they've got the positions at the university, they've got the labs, and they're doing all these things. But I still think that people should be looking at uric acid and the inflammation it causes in the pancreas and in the kidneys of humans, and the possibility that it also could be affecting the capillary bed of the lamina, and that could be leading to an ischemia. That's what I think. But again, it's just my guess. Nobody actually knows for sure, and they've been studying this for decades. They've been taking horses' feet apart. They've been looking at them with PET scans. They're looking at blood flow, venograms. They're looking at all this stuff. And nobody's actually come up with anything other than stop feeding your horse. They're all agreeing it's all coming from overfeeding the horse. So, yeah, I would just keep that. And she comes to that. She says it's basically a high carbohydrate load, and managing the diet is the #1 goal, and it requires owner compliance. So she then goes into the oral glucose test, where the horse gets Caro syrup after being fasted for, they said, I think it's 3 to 6 hours. The oral glucose tolerance test, it's used in humans, and the horse gets Caro syrup light, and then blood is drawn just before the dosing, and then 60 minutes and 75 minutes and 90 minutes later, they draw blood plus or minus the 90 minutes. And if you get a result of high insulin based on this time frame after that, then it's going to be diagnostic for insulin dysregulation. They also had an insulin tolerance test, and I'd never heard of that, but some of the people in the audience had done this before, where you take the horse that's not fasted, you collect blood, and then you give insulin, and then 30 minutes later you feed some grain, and then you measure the glucose. And if it doesn't decrease, then you have insulin resistance. And I had some questions about that. They said also be cautious because you could suck down too much sugar and the horse is going to collapse. So you should have 50% dextrose ready just in case the horse gets that way. So it's not without risks. And then there's some new tests coming out. One is going to be stall side, which is kind of cool. So your vet can come out there, draw blood, do a test, and within a short amount of time, you might find out that your horse has insulin resistance, which I think is interesting. But right now, ACTH could reflect the fact that your horse has a lot of stress going on. Stress can come from he's in high training, or you just shipped it in, the cortisol is high, or the horse has actual diabetes. And there's just a lot of things. And if you're getting confused about this, that's the point. There's a lot of tests out there, but the bottom line is the best test is the horse obese. I said, okay, that makes sense. So if he's obese, you don't say, wow, what a good looking obese horse you have. You say you have a horse that's equine metabolic syndrome. I mean, he's got it. You don't even have to test for it. You have to do diet and exercise. And as long as the feet are okay, exercise the horse. Just increase the exercise, because insulin isn't required to get rid of glucose in an exercising human. And that's what they're saying. Look at the racehorse. It's out there just working its tail off. It's like a teenager, and it eats tons of grain, and it doesn't get insulin resistance because they're using up all the calories while the horse is breezing. But the horse is out in the back pasture, is eating grass 24/7. And then you're adding hay on top of it. And because the horse is such a good horse and your, love of your life, you bring out, bagfuls of carrots and apples. The horse is just getting glucose load after glucose load, and they're gaining weight, gaining weight, gaining weight, and they are on track to become metabolically unfit. And that's going to lead to insulin resistance. And I've gone over this in other podcasts. What you're going to do is you're going to, with the excess sugar, cause increase of production of body fat. And that increased body fat is going to go to the cells and say, hey, use us for fuel. And of course, the muscle cells are going to say, no, we can't, because we've got all this glucose we have to burn up. And so the GLUT4 transport chain doesn't work. And then the insulin's resisted, and the glucose is shunted away over to the liver. It's turned into body fat, and the process just keeps going on. So this is what she recommends. She says non-structural carbohydrates of less than 10 to 12%. So either have your hay tested or soak the hay. And she gets into that in the next lecture. Don't turn the horse out on pasture. Well, pasture is loaded with sugar too. I mean, starch is sugar. And especially the springs pasture, as they're producing more and more glucose from photosynthesis, they're not only going to have glucose, they're also going to have fructose. And that's going to trigger some of these horses and flip them over the edge. She also recommended frequent meals. So if you're going to feed your horse a meal, make it small, because that way the bolus of insulin isn't going to be as high. The idea is that there's a cutoff, a level of insulin that you don't want to go above. If you go above that, you're going to have insulin resistance, which is going to lead to these factors that can lead to laminitis. And she says you want to keep the insulin low. So that makes sense. If you look at insulin as being the cause of laminitis, if you have a bolus of food that spikes the insulin, then that insulin could trigger a laminitic event. But if you don't believe insulin is going to cause it, then feeding the excess sugar is leading to whatever factor that's causing laminitis. And this is the part that everybody just isn't agreeing on yet. She also warned that amino acids can trigger insulin release. Now, you guys know that I'm a big fan of soybean meal, and that horses that are pre-laminitic or even have laminitis should be fed high-quality protein to feed the hoof to make the hoof stronger and repair itself. And so far, that's working out pretty well. I wanted to ask her what amino acids, which particular amino acids are you talking about? And in my book, amino acids can be converted into glucose. All amino acids can be converted into glucose, especially when glucose intake is high, because you have insulin resistance to taking all free glucose and driving it into the fat cell as fatty acid. So the brain is screaming, hey, I need some glucose. So they're going to create glucose out of amino acids. And I think that's where this is coming from. So I've always said the first thing you have to do is soak the hay, decrease the amount of sugar that's entering the horse's body. Now the horse start losing weight. The classic sign of low insulin is a horse losing body fat, because you can't lose body fat if there's high insulin. It just doesn't work. I went over that with the insulin-glucagon ratio that I talked about a couple of times ago. You got to drop the insulin down to less than glucagon to get the fat out of the cells. When that happens, they're not going to convert amino acids into glucose, not any more than what they normally do. So that was the end of the that lecture, and she moved on to the next lecture, which is treating equine endocrine diseases. And she said, number one is diet, and I couldn't agree more. She said soaking the hay is so important. Couldn't agree more. She put out different things: 16 hours soaking, 14 hours soaking, 30 minutes soaking, 15 minutes soaking. And with each reduction in time, you had a decrease reduction of the non-structural carbohydrates, which are the free sugars that are in there. And every bit of reduction helps. I've told people you can soak it at least an hour. And I know people soak it for 12 hours. And I really think You soak it for 12 hours. Like you go out there, you do morning chores, you throw the hay in and let it soak. And then in the afternoon, feed that hay. And I thought it was interesting. She said, and don't dump the sugar water in the paddock where the horse is. And I never thought about that. Of course, you dump it outside where the horse can't get to it and rinse it off where the horse can't get to it and then drag it into the paddock. But, sometimes I forget the obvious. And it was nice that she did think about the obvious and said that. So I thought I liked that. She also showed that steaming hay does not decrease the non-structural carbohydrates. And I've said that before. So let's just not do that. Then she said protein, 34% protein showed an insulin spike. And again, it is not just the addition of protein. You have to look at the other factors that are occurring metabolically. And you have to get that horse on a fat-losing diet and then add the protein. And that's all I can tell you. They I didn't ask her because that would go into the weeds. And from her presentation, I thought that she didn't really want to get into the weeds, so I didn't ask her. She did talk about exercise, and I thought what was really interesting was she recommended aqua treadmills or swimming. And it's brilliant. If you've got access to a pool or an aqua treadmill, they're all over Wellington. You put the horse in there, fill it up with water, and then the horse is buoyed as it walks on a treadmill. They're really interesting. I've got pictures of it on the website if you want to take a look. But then she also recommended walking on soft surfaces. And I'm concerned because if a horse has laminitis, every time the horse walks, he's going to be pulling that coffin bone away from the front of the wall. And you really want to minimize that. And walking on soft surfaces actually makes that harder. So I didn't want to argue with her. If your horse has an acute bout of laminitis, I don't think walking is the best thing. The best thing is to put him in the space shuttle, set him up into space and get all gravity off. I mean, throw him in a lake and leave him there, just take the weight off the feet and let everything heal up. But of course, we can't do that. But I did like the idea of aqua treadmills and swimming, if you got that ability to do that. She recommended Thyro-L, which is thyroxine, which creates hyperthyroidism, which basically causes weight loss. And she recommended a high dose for 3 to 6 months to increase fat loss. Well, if you've ever overdosed T4 or Thyro-L in a horse, it's like giving your horse caffeine. They're like, oh boy, so their metabolism goes up. And she said an 8-week treatment, you'll get a decrease in 20 kilograms. So if it's 2.2 pounds per kilogram, we're talking about 40 or 50 pounds loss. And if you're talking about a 1,200-pound horse down 1,150, I guess that's significant. I don't know. If you're talking about a 600-pound pony that should be 400 pounds, it's not there yet. And I don't know if you want to deal with a caffeine-induced, caffeine-like induced pony, but just remember that your vet might recommend Thyro-L, and go ahead and try it. Everything helps, but there's no downside to it other than your horse is going to be a little bit hyper. Then they talked about metformin, and anybody who's been listening to anything about longevity in humans, they're now realizing that metformin may be helpful in creating a less inflamed life and promoting lifespan, a health span. So a lot of people are just taking metformin for that reason. It became popular in horses, but it doesn't work in horses the same way it works in humans. And that's interesting because I've never been a big fan of metformin in horses, just based on what I'm hearing. But I won't say half, but there's a lot of people who found that metformin is actually helping horses. And the studies are showing that it decreases the absorption of glucose in the GI tract. So basically, you're feeding a horse soaked hay, if there's still some glucose in there. If you add metformin, whatever glucose is coming in, getting digested, is not going to get absorbed, which I think is kind of cool. And you can do the dosing 30 minutes before a meal. and do that up to 3 times a day. She said that there's an adverse reaction, dose dependent, of oral ulcers, and it also does not work in all horses. So some horses are just refractory to it. So no big deal, but it blocks cell proliferation and blocks activation of cytokines and inflammatory markers. So it also reduces leaky gut, it alters the microbiome, and it's anti-aging, but it's a poor bioavailability in the horse. So it's good to add metformin to diet and exercise. There's no real downside to it as long as you don't have leaky gut, oral ulcers, and the horse can tolerate it. If it seems to help, well, have at it. It's not going to hurt. It's going to prevent the absorption. Now there's a new class of drugs that I've been talking about called SGLT2 inhibitors, and SGLT1 and 2 are enzymes that are in your kidney that when you create urine, it prevents the loss of glucose. It takes glucose in the urine and actually shoves it back into the body. So it preserves glucose in the blood. That's what it does. So with SGLT2 inhibitors, especially the SGLT2 inhibitor, not the one. One is only 10%, 2 is 90%. It's going to block the reuptake of glucose into the body. So you're going to have a significant drop in blood glucose. So you're going to be hypoglycemic. And secondary to that, you're going to have a significant drop in blood insulin, which is really, fantastic. It's being used in Australia, Europe. I think a couple of people said they've used it here in horses in America. The big side effect is you're going to get a tremendous increase in triglycerides, which is risky. Now, I found that fascinating because nobody's talking about this. They never once said that one of the insulin's roles is to keep fat in the fat cell. And if you're going to get rid of insulin because there's no more glucose, you're going to open up the doors to glucagon that's going to allow the fat to come out of the fat cells. And they're going to come out as triglycerides. And they're going to be all over the blood, running to a place to be used. In other words, if you went into autumn and food sources became scarce, and slowly over time, your food intake of sugars decreased between, let's say, October and December as winter is upon you, your body's going to adapt to the increased output of triglycerides from your fat that they could use and convert the mitochondria in the cells to using that as a fuel. Remember me talking about mitochondrial flexibility? That's the ability of the mitochondria to use sugar or fat for the fuel. But when you give a dose of this SGLT2 inhibitor, you're rapidly increasing the amount of triglycerides being released because you're rapidly decreasing the amount of insulin. So it's just like too rapid. But so far, they're not having any adverse signs. So they're just basically saying you got to use it in really bad cases. Well, okay, if you've got a horse that's really that bad and you want to do it, I don't know if that dose is appropriate, whatever they're using. Maybe you should use a little bit less. I don't know. But I think the biggest holdback of using this, Steglatro is a brand, and it's a human brand that you're using in horses. It's ertugliflozin. I did a podcast on this about the Australian study that they did. So look back in the podcast to find it. But you're going to have decreased weight, decreased body condition score. So it's going from a 9 or an 8 down to a 7 or a 6, which is great. You're going to have decreased insulin. You're going to have increased fats in the blood. But here's the biggest kicker. You best have thousands of dollars because it ain't cheap and there's nothing else available. So if you have a horse that's critical and you have to eliminate the insulin and try to get the laminitis under control, and you've got a couple $1,000s spare, have your veterinarian use this Steglatro as an SGLT2 inhibitor and give it for once a day shot for 16 weeks. That's a long time. That's thousands of dollars. And I would probably, if I were the vet, titrate it so we don't have rapid loss, but it's going to be a little bit slower so the horse can ease themselves into it. And of course, the best thing is don't get your horse, don't have it get laminitis. Just don't do it. Stop feeding grain. If your horse is obese, or if your horse is so thin and you're feeding it 15, 20 pounds of grain a day and it still can't gain weight, that horse can become insulin resistant just as well. It's called skinny fat. And those horses can have laminitis. So be aware that if your horse doesn't have laminitis yet, it's going to. And if you can stop that, ain't nothing better than the original equipment. Never forget that quote. Ain't nothing better than the original equipment. And as soon as you have laminitis, you can do everything on the list to, soak the hay, add some protein, use the SGL2 inhibitors, add metformin, do all this. Money's pouring out of your pocket into this horse that's in suffering and pain. Hopefully that you get it stopped in time so you have a salvageable horse, but it's not like when it was born. So diet and exercise are the best. Other treatments she covered was resveratrol, vitamin E, and microbiome modifiers, but there really is no good evidence that any of those work. And of course, PPID, you're basically stuck with percent or pergolide. She really wanted you to understand that making pergolide is very, very difficult, and you should avoid compounded pergolide. You should be buying percent. And I have to agree to her. I hate compounded drugs because there's always risks with that. But anyway, if your horse won't tolerate pergolide, there is an injectable compound called cabergoline, cabergoline, cabergoline. And some people have used that, but it's compounded. So again, you have the risk of compounded things. Of course, cyproheptadine, that's been around forever. It's pennies to use. It's a serotonin antagonist. And you can add that to percent if you want a little bit more effect. And then she said antioxidants and chasteberry don't work. So that's it, I think. Yeah, hold on. What's this? Yeah, that's it for endocrine diseases. And I'm glad you stuck through this because we've gone over it a million times. PPID is a neurodegenerative disease. Nobody has told you what causes it. They just say it's an aging disease. I say it has something to do with inflammatory foods and lack of protein in the diet because protein is necessary for the enzymes and for the making of the neurotransmitter dopamine, which is what percent is. So let's just get our horse's house in order. Let's just do that. I mean, if your horse is healthy and happy, let's make it healthier and happier. Let's not wait till the fire's in the house and we're trying to find the fire extinguisher and put it out. Just doesn't make sense. So now my last lecture was vitamin E for horses, what veterinarians need to know, by Kelly Weingard, PhD, Purina Rep. Now, if you recall a couple of podcasts ago, I talked about her writing in The Horse a question that said there's a new veterinarian who came in to do teeth who suggested that we feed just soybean meal. And she spent a long time responding to that. And I thought that was interesting that just a day later for me reading that, here she is in front of me. So let me go over her talk, and then I'll tell you that I went up afterwards and introduced myself to her. But basically, vitamin E comes from the hay, and the greener the hay, the higher the vitamin E. It's stored in fat tissue for about 6 months. So when the hay goes, or when the pasture goes away, the horse can still dig into their vitamin E stores and get through the winter so they have enough for next spring. That's how it's supposed to happen. All right. So there's 8 different forms in nature. But the form that we want is the alpha tocopherol, and there's 2 versions, and there's a chemical version. It's called D-tocopherol and DL-tocopherol. And if you listen to my podcast on vitamins, you're going to know that the DL is a synthetic, it's more stable, and it's cheaper. And the straight D, which stands for dextro, which means the right twist. It's a chemical way of looking at it, where D and L is the right and the left, dextro and levo. And that's just Latin for right and left. The D is a natural. It's got increased bioavailability, which means the horse can consume it better and pass it through the gut wall. And it should be used in all clinical cases. So whenever you get vitamin E, look for D or DL in front of the word tocopherol. And the D is natural, DL is synthetic. Then she said, what's the level of vitamin E in certain feeds? Well, grass, it's between 15 and 50 international units per pound. And that's really good. Hay can be anywhere from 0 to 25. And of course, as soon as you cut the hay, the vitamin E starts to degrade. So the older the hay and the less green it is, the less vitamin E that's going to be in it. She said grains have 10 to 15 international units, concentrates 80 to 200 international units, and ration balancers have between 500 and 600 international units. Now, what's interesting is she works for Purina. So she's high on her ration balancer called Enrich 32. And you know my feeling on ration balancers, which I'll go over a little bit later. But notice that the fresh grass has 15 to 20 international units per pound. And ration balancers is 500 to 600 international units. The difference is in ration balancers, it's synthetic. So it's not going to be absorbed as well. So even though they have higher vitamin E, it's just not going to get into the system. So it's not going to be as high a spike. I thought that was kind of interesting. She didn't say that. That's my interpretation. But then she said, what's the daily requirement for vitamin E in a horse? And the daily requirement is 1 to 2 international units per kilogram of body weight. So 2.2 pounds per kilogram. So it's about a half to 1 international unit per pound of body weight. So that's between 500 and 1,000 grams international units per day. International units is smaller than a gram. They're very small. And the maximum should be somewhere between 5,000 and 10,000 international units per day. Just remember, when you exceed 10,000, you're going to get a lot of problems, because vitamin E, like all fatty, the fat vitamins A, D, E, and K, they can become toxic at high doses. So in healthy horses, there's little evidence for supplementation. That's important. If your horse is healthy and he's got access to pasture or good quality hay, you don't need to be supplementing with vitamin E. They're going to get more than enough of their daily requirements from those two sources. You don't need to be adding ration balancers, in other words, in healthy horses. But if you don't have green grass, if you don't have hay, or your horse is an athlete, she recommended adding a ration balancer to increase the vitamin E. And, you know, she sells the stuff, so I don't want to argue. But there are questions. Why would a horse be vitamin E deficient? So are they not absorbing it? Or don't they have access to fresh pasture? Or it's limited? Or the forage doesn't have vitamin E? Or the exercise level is so high that they're using it up? Is a horse diseased? Does he have one of the severe diseases? The sample taken wrong and metabolism isn't right. So there's a lot of reasons why horses are deficient in vitamin E. And what's interesting is Purina, she's a senior vet in nutrition there. Not vet, she's not a vet, the senior nutritionist at Purina in charge of the horse program. And people started calling in, hey, I'm getting these low vitamin E readings in my blood values. And they couldn't figure it out. So they had to knock their heads together to figure out what was going on. And they still don't have a really good reason why horses are suddenly getting low vitamin E levels in blood draws. And, you know, if they're getting green grass hay, they should be okay. So they still don't know exactly why the levels are low. But what are some of the diseases of a low vitamin E diet? And one of them is equine neuroaxonal dystrophy, or END, and its other counterpart, equine degenerative myeloencephalopathy. And it's usually genetic there's a genetic basis, so it's not being absorbed right or utilized right or made correctly. I don't think they actually know. They're usually in 6 to 12-month-old horses. And once you see signs supplementation doesn't help, there's a factor that's occurring that's not letting the horse get vitamin E in there, and they usually end up dying. Then there's another disease called equine motor neuron disease, or EMND, where the horse gets weak. There's muscle loss, really seen in the tailhead muscle fibers. And my notes kind of fail me here. I'm not too sure what that means, but they say it's usually a horse that's been in a dry lot for 18 plus months. So for whatever reason, you've got a lame-legged horse and you put them in a dry lot and they're in there for a year and a half, not getting access to any fresh grass, and the hay is poor, they could get a deficiency in vitamin E that's nutritional. And I've always said, show me a horse that has vitamin deficiencies, with the exception of starving horses. And a horse that's being starved for whatever reason, that's a possibility. Then you have vitamin E responsive myopathy, a precursor to equine motor neuron disease, where they're having difficulty getting uptake in the muscle. And they said, who needs vitamin E supplementation? Well, horses with these diseases, white muscle disease, muscle disorders like PSSM, polysaccharide storage myopathy, and especially when you're adding a lot of fat or oil. If you're putting in 2 cups of oil into your horse's feed, they can get actually vitamin E deficient, which I thought was pretty interesting. Excess vitamin E greater than 10,000 international units per day is going to impair bone mineralization, interfere with vitamin A metabolism, and decrease blood clotting, so don't do it. If you have clinical cases, of a vitamin E deficient disease, you should use natural liquids, so the D form of tocopherol, and get in liquid form. It comes in 3 things: Elevate WS, Nano E, and M-Seal. Those are 3 products. If you want to just have a little prevention and you want to be adding vitamin E, get a natural source. Again, the D-tocopherol in the powder form is going to be cheaper than the liquid form, and you can add that. And then be careful of selenium. You should not be using vitamin E and selenium in combination, because you can get selenium toxicity, and that's no fun. You don't want that because it'll cause the hair to fall out of the mane and the neck. So avoid that. Just do vitamin E by itself. So if the serum vitamin E is normal, there's no need to supplement. If it's low and there's no clinical signs, then start with 2,500 international units per day, liquid, natural, for 3 weeks, and then recheck. And if it's still low, then go to 5,000 international units. But if it's low, then you're going to go to 5,000 of the powder. If it's still low, go to 5,000 liquid for another 3 weeks. And if there's clinical signs, you want to go up to 7,500 international units liquid per day. So that was it. I went up to her afterwards and introduced myself. I said I was probably the vet that she talked about in that question answer. I said, I believe that most horses are chronically protein deficient. Her answer was, I absolutely agree, 100%. And I said, okay, well, that's good. But she believes in her balancers because she believes that there is a purpose for all of them. I said, well, what about lignin sulfonate? She says, well, I can't by confidentiality tell you how much is in there, but I can tell you that it's a very small amount. And she says it has to be in there as a binder. And I said, all right, so it's a binder. So you have to do it to do that. I'm thinking to myself, well, why not just, get rid of all these inflammatory ingredients and get your horse on good pasture and good hay, and supplement the protein source, which is what I've been saying. It's the cheapest way to go. But she's a big fan of what she puts together, and she's had a lot of thought going into it. And so I have to congratulate her. I think she's a very level-headed person. I would love to have future conversations with her where we could pick apart and get a little bit deeper into this, because I believe that horses being fed all these grains that Purina and other companies are offering are what's causing the problem. So if you want to feed a Purina product because they have something in there that you think is good, fine, just don't feed as much of it. Don't feed calories in excess of what your horse needs. If you want to feed these balancers, if you want to feed Purina products or anybody else's products, how about cutting back on the hay or the pasture to increase the total non-structural carbohydrates that are causing all this inflammation and excess fat production in your horse? I mean, let's put it this way. I love Raisin Bran. I could eat a whole bowl of Raisin Bran right here, right now. I love it. It's great. Is it good for me? No, I think there's lectins and other things that are in there causing inflammation. But having it every once in a while, as long as I don't glob down other sugary things and maybe don't eat anything else, let my body accept that. So there's balances that you want. If you want to be a fan of all these commercial products, fine, be a fan of them. Just stop feeding hay 24/7. Start exercising your horse more and start training your horse the ways evolutionarily was created. Anyway, I got to go. Actually, my battery's just about out, so I'm going to be cut off if I don't shut up. Thank you for sticking with me through all these. I hope to bring you some other interesting topics coming up. But thanks for blasting through these things, and love y'all. So appreciate it. Doc T out.
Hey everyone, Doc T here. Thank you for listening to my content. Would you do me a huge favor? Would you please subscribe, comment, like, thumbs up, and give a star review? However it's presented to you, I want you to do that. There's two reasons. The first, of course, is to improve this product. This way I know what you like, what you don't like, what I can improve upon, what topics you want me to cover. But more importantly, it's also going to help others find me. And by doing that, you are now engaged in this mission of helping horses thrive in a human world. By you helping, we can reach others. And that I would be so grateful for. And remember, go to thehorsesadvocate.com for updates on this information. Thehorsesadvocate.com. And again, thank you so much for being here. Doc T out.